muted.
Sorry, no, I don't have any slides. I'm just gonna
Okay.
do introduction in the beginning, and then I'll pass it over to you, Norma, and then you can introduce your two presenters, and then we can start from there.
Hi, Mary.
Okay, great. Yeah.
Okay.
Hi, Marianne.
Hey, Bill. Hi, Norma.
Hi, Marianne. Aloha.
Aloha.
Okay,
I can still say that when you go to Texas, you know, it'll have probably a heavier meaning. I don't know. I have family in a place called Sugarland. Is that correct? Sugarland?
Sugarland? Yeah, there's Sugarland and Sugarloaf.
Oh yeah, and Hurricane Harry stopped short of their cul-de-sac by a block.
Oh my gosh.
Oh, talk about divine intervention and all of that. I could not believe it.
Hurricane or tornado?
No, you know the one that they were underwater, people's house, you know, streets and everything. I think it was Hurricane Harvey.
Harvey, yeah. Yeah.
Okay.
What is Debbie is requesting remote control of your screen? I don't know these messages. I'm gonna hit okay, Debbie.
So that means I'm controlling the slides.
Okay.
Unless it's you.
You know, I thought I knew all the lingo in Zoom, but I think because you're doing a webinar, I gotta learn this.
Okay, I think I got it.
Have you ever done one of these where you put yourself on Facebook Live?
No.
Okay, so one of the attributes we just had with Comprehensive Service Center, which the targeted population are deaf, deafblind, hard of hearing. That's what they do. They put us on Zoom and concurrently Facebook Live. So there's a lot to learn about. The Zoom feature of Facebook Live is right there, right on the bottom. You just click on it, she says, the director. I'm like, okay. There's a lot I need to learn.
Sorry, hold on. Sorry, my dog.
I'm glad
He didn't like my picture, huh?
Way to make it homey, a homey presentation, Debbie. I love it. We're a dog family.
I'm trying to get the health thing to show, but the virtual screen just won't let it come in.
I mean, I can't.
That's right.
I have our logo in the back. I'm going to change my video because we have enough of the logo here. Okay.
Sorry, do you mind if I assign someone else to control it? Because my mute button went away and my dog is
I'll do it.
Oh, I'll do it. I'll do my part.
Oh, it's only one person.
Okay.
Are you
Go
sure?
ahead, give it to me. If you don't mind, if Norma doesn't mind, I'll go ahead and control the.
Okay, go for it, Bill.
Back to Norma. When you click on view options on the top where it says you're viewing Norma Kop screen, you can click on request remote control and then Norma will get the. Oh yeah, I also need this to do the polls too. So either way.
Oh yeah, who's doing that? Because I don't know how to do it.
Because now I have my bottom screen back up. Earlier it
Okay.
You should have got my request, Norma.
Oh, there we go.
Oh, perfect. Okay.
Okay. So Marianne, what just happened was Bill is going to take the reins on just for us to just say next slide.
Okay. Thanks, Bill.
Okay.
Got it, Bill?
I'm just practicing. Okay.
Okay.
I want to make sure.
Sorry, I guess somebody's outside, so my dog is barking at a stranger.
Well, that's good. That's good.
How do you like working at home?
It's convenient. Some days I'll go into the office and some days I'm at home, so it's not like I'm at home all the time, but it is nice to see people face to face.
How's that look, Norma?
Good. I need to do this Audrey Hepburn look and go get a straw. I'll be right back, okay? Hold on. Believe me, some of our volunteers don't know who Audrey Hepburn is. They're that young, Bill. Hold on just a second.
Oh my.
What do you think, Marianne? Is that coming across okay, or is that too bright?
No, that looks good.
Do you see
So-
it? Or?
Are you holding up?
It's blending into your nice scenery.
Yeah, no, it's
Right there. Oh, yep.
Yeah,
I
it
gotta
blends into
play with it.
the
Okay.
background.
Yeah, I think you just have to hold it at the right angle, maybe.
What if you hold it in front of your face? I mean, I know you don't want to cover yourself up, but
Don't bother me none.
Marianne, could I ask you to move your monitor just a tad bit? So
way?
just if you can, to the right frame of your glasses. So to your right.
to my right. Oops, that way more?
A
more,
little bit
man.
more. Perfect. Yeah, yeah, perfect. Okay, we see some trees and we see a little bit more. It's more back. Oh, you moved again.
To move back, or you don't want me on the
There
side?
you
There
go.
you go.
There you go. Perfect. You're
How's
right.
that?
Your head is caught in that corner. It looks good. Yeah, perfect.
Okay.
You know why? I'm psychologically going, oh, I want to see what's on the right side. What's in the right? But it looks a little bit more balanced now.
Are you folks
Okay.
ready? I'm going to start the webinar. I want to start it, open it up so people can start joining. And
Sure.
then I give it till about 10:02-ish, and then I will start. Is that good with you?
Is that good? Okay. Thanks, Debbie.
And I will mute myself too while I.
Bill, can you go back up to the intro
I'm
slide?
trying to right now. Something happened. There we go. Hold on. I guess it doesn't like saying, there we go.
Okay, so it's 10 o'clock right now. We'll wait another minute or so as everyone logs on.
Good luck, Bill and Marianne. Have fun with this.
Okay.
Okay, well, I don't want to hold you folks up since I know we have a long presentation, so we can go ahead and get started. So good morning. Welcome to the Navient Hawaii Community Connect Educational Webinar. My name is Debbie and I'm the business manager at Navient Hawaii. But before we start, I'd like to give a little introduction on Navient Hawaii. So some of you may know us as Hospice Hawaii. We're one of the very first hospice providers in the state. And for 40 years, Hospice Hawaii was our name. Recently, we added a new service called Integrated Care. As a community organization, we're always looking at different ways to support patients and their families within our community. And a while ago, we had identified a gap of patients who weren't seriously ill enough to qualify for hospice, yet they were in desperate need of additional support. And that is how we developed Integrated Care. It's an extra layer of support to help seriously ill patients navigate through the difficult healthcare system, keeping them out of emergency rooms and hospitals while continue to receive curative treatments. And because of that, we have changed our name to Navient Hawaii to reflect our broader range of care. So we're the same organization with the same mission, same values, and same people as Hospice Hawaii, just with the new name, Navient Hawaii. Now, just a little housekeeping before we get started. This webinar will be recorded and posted onto our website. If you have any questions during the presentation, please type them into the Q&A box below. We'll save some time at the end to answer your questions. And with that, I will turn it over to Norma from S&P Hawaii.
Mahalo, Debbie Lee. We're really, really honored to be here today. Your role as a beneficiary or soon to be family member or caregiver is so critical. And today we'll present some information on the subject of Medicare fraud and abuse to ensure that you can do your part to take charge and help prevent Medicare scams, fraud, abuse, and even errors. Next slide, please.
Sorry, no control.
Okay, thanks, Bill. So who are we? Senior Medicare Patrol programs, or SMPs for short, are federally funded in all 50 states, District of Columbia, and the US territories of Guam, Puerto Rico, and the US Virgin Islands. The US Administration for Community Living, known as ACL, awards us a 5-year grant program every 5 years. So it's since 1997, we've been in Hawaii. And next year, 2022, will mark our 25th anniversary in the 50th state. What we do here is we help you prevent, detect, and report healthcare fraud and abuse, and we'll discuss the differences today. We help preserve the integrity of the Medicare program because we know it's not a guaranteed health plan. So we've got to work really hard to safeguard it for not just us, but also our families and even maybe perhaps hopefully our grandchildren. We also rely on our volunteer team as we will meet Bill Morrow and Marianne Kadek today to perform various SMP Hawaii tasks. This is our mission. We help to empower you and assist you again to prevent, detect, and report these scams and frauds that are continuously rising, especially with COVID-19. And we do this with these types of events, these outreach and education programs, even one-on-one counseling on the telephone and email, and again, through education, whether it's through television and other types of media, and also continuously helping kupuna and their caregivers and family members. We are so honored and very grateful to have Marianne and Bill here. I'll introduce them and then we'll have them take over the presentation. Marianne Kadek currently resides in Kailua Kona. She's been here as a registered nurse and serving in various healthcare capacities over a almost 45-year span. So you can read up on her bio here. She is very active in the community, and at the end of this month, we're going to bid aloha to her, but thank goodness to virtual volunteerism, we'll still have the porch light on for her to help us here in Hawaii. And as she moves on to different adventures at the end of the month. Bill Morrow, you can see here, he's part of our US Armed Forces, is a retiree from the Navy. He has worked in various capacities. I've known him as a Heald College instructor in both the medical office administration and medical assisting, working with literally hundreds of students entering their fields of work. And, you know, I've known him when I worked as Dean of Students, he never missed work. I mean, never called in sick. And so we're very grateful to have both Bill and Marianne today. At this time, I'd like to introduce Marianne, who will go into what our agenda is today, and then we'll hear from Bill Morrow on various other topics as well. So Marianne.
Thank you, Norma. Aloha, everyone, and thanks for having us all here today. This is my first presentation, so be kind. No, I'm kidding. So on the screen, you see the 4 objectives that we're hoping by the end of the presentation today, you'll be able to reiterate back to us. And just know, I'm going to cover abuse and fraud in my presentation, but it's not just about the money. It's about preserving Medicare, keeping Medicare safe, and allowing the Medicare beneficiaries to get care with dignity, and then preserve that legacy of Medicare. That's really our main goal. So we're hoping that you're going to be able to define some key terms for healthcare scams. We will try and give a couple examples of some common and current Medicare fraud and abuse things that are happening right now, especially during the pandemic. Bill will be covering SMP Hawaii's prevention plan on how we protect ourselves. And then towards the end, we're going to highlight the benefits and advantages of being a volunteer with SMP and why it's so important. Okay, next slide, please. Okay, Why do we care about Medicare fraud and abuse? I mean, I have to be honest, I didn't used to think about it very much, but now that I'm a beneficiary, it really hits home. But it affects us all. In 2020, Medicare's budget paid $40 billion out to scammers or for inappropriate billing. It's taxpayer dollars. So that's how it affects all of us. It's not just because we're a Medicare beneficiary. And then that puts the future of the Medicare trust at risk for us, our kids, our grandkids. And you can see there listed some of the impacts to Medicare beneficiaries by the fraud that goes on. The last one there on the list is loss of service or treatment. And believe it or not, there actually are people in this world who use someone else's Medicare ID number or an other healthcare insurance ID number to obtain care. I never thought that could happen, but I haven't seen it that often, but I have seen it happen. And what that does, though, unfortunately for the beneficiary, if they ever get to a point in their life where they need to use that benefit, say for a surgery or a procedure, the person who stole their identity already has used that benefit, and they're going to be affected by that. And that's a bad outcome. Okay, next slide, please. So abuse in general is when providers supply services or products that aren't necessarily medically necessary, or they don't meet professional standards. All of us that are in healthcare know there's so many regulations and policies and procedures and guidelines and things that we have to be aware of and that we're supposed to follow. And so it becomes Medicare abuse, of course, when it involves a Medicare member. So that's just a general definition of abuse. I can give you, I don't know if it's the greatest example, but in a few years back, there was a healthcare entity here in Hawaii where services were being provided by physician's assistants. And I think I don't know the exact details, but there was an issue with the services being provided by them and being billed by them and then being paid by Medicare. So it came to light. It was considered abuse. It wasn't necessarily intentional, but there were fines involved. And then for a 5-year period after the episode occurred, there was monitoring and chart reviews and all that kind of stuff that involved this healthcare entity just to make sure that the professional standards were being followed. So it was a learning opportunity for everyone involved, definitely. Okay, next slide, please. So the difference between abuse and fraud takes it another step further, whether it's intentional, big, bold letters underlined. Someone's intentionally billing Medicare for services that were never even received, or they're billing at a higher rate than was justified. Not a good thing. So again, remember that the main difference between abuse and fraud is that there's a definite intent to fraud Medicare involving money or people's identity. So when it comes to fraud, there's much stronger penalties. There can be criminal convictions, there could be jail time, and the individuals involved could be banned from participating in Medicare temporarily or permanently. And they may have to make financial restitution to the victim that was involved also. Okay, next slide, please. So on this slide are some examples that you can scroll through of Medicare abuse and fraud. And again, it just becomes fraud when there's actual intent to do these things. These things can happen in healthcare, unfortunately. And just know that I'm sure many of you have seen it. A lot of the errors that occur in billing in healthcare, they're just a result of human error. We're not bad people, but we are only human. And sometimes we do make mistakes. So if it's an occasional thing here and there, again, it's a learning opportunity, needs to be corrected. If there's a pattern over a period of time, then they really start looking at it like it is abuse. And if it goes that one step further where there's intent, it becomes fraud. So say, for example, a patient comes into a clinic. That's my most recent background was clinic services. They came for wound care. They have a chronic wound. They need to come in 1, 2, 3 times a week for some care of that wound. And the provider had a plan for the care when that person came in and coded the chart that way. Maybe the visit went a little bit differently and exactly what was coded didn't happen in that visit. There were some supplies given that were charged, and maybe the member was supposed to get a device or a supply to take home with them. And they ended up leaving the exam room and going home before the staff could give it to them, but they got billed for it. So stuff like that can happen. Again, you see, it They weren't bad people doing it. It's just stuff that happens. So we all have to pay attention to it and be aware of it and be savvy consumers. Okay, next slide, please. This is a busy slide, but it's meant to show you in a diagram those schemes that you see on TV, those call center things. I know that you've all seen them. It'll be an ad on TV or an ad on radio where they talk about a knee brace or back brace, and you too can get this, and they make it sound so wonderful and so easy. So up in the top left corner, it starts, there's this group of conspirators, and they do have a call center. They also have in their ads a phone number that people can call, or they have telemarketers directly reach out to beneficiaries, offering them these braces, this wonderful benefit that you can get, and it's free. Medicare will pay for it. So the person talks to people in the call center, they verify that they do have Medicare, and then they send them to a telemedicine company for a visit with a provider where the brace is ordered. There's a prescription written for the brace. The call center then collects all these prescriptions that this telemedicine center has provided, and they send them to the medical equipment company who actually buys these prescriptions from them. And then the medical equipment company sends the braces out to all the beneficiaries. The company then bills Medicare, probably too much, and pays a kickback to the conspirators who started the whole process. So pretty smart, pretty clever. And it keeps going on and on and on in our world. Even though we know that they're out there, they just know how to present themselves really well. Okay, next slide, please. COVID-19, our world with COVID-19. I think our scammers and our fraudsters are just really loving COVID-19 right now because they have managed to milk the system remember in the beginning, there were all these treatments that came out, all these self-tests that you could do, even different vaccines, different cures. People bought stock in these companies that were offering medicines as cures. Some of the supplies that came out weren't even real supplies. They were fake. People were paying money if they even got them at all when they ordered them, like on Amazon or other places. So it just opened up the world to a whole lot more fraudsters and scammers, unfortunately. And remember, their main goal is to get people's protected health information or their Medicare number or their financial information too. That's really what they're after. Next slide, please. There's also some other medical services related to COVID in our world right now that leave us open to fraudulent activity and scammers, and that's telemedicine. You can recall when COVID first came, they didn't want anybody coming into clinics and hospitals. Use telemedicine, stay at home and do it over the phone or do it over a video camera. But it left people wide open to even more scams. Hospital care can be scammed, office visits, long-term care, all these organizations, home health, and unfortunately, even hospice in some places can be part of it, where the patient, it's so sad, they're falsely determined to be terminally ill. And then a nursing home, maybe in hospice, they have a collaborative relationship and they get kickbacks from falsely billing or falsifying information. And then at the bottom of the slide, there are health insurance scams going on, lots of charity ones, a lot of financial ones, and some are healthcare related, some are not. So it's just amazing what all this has done to our world. Next slide, please. So for all of us, and I know you've heard this before, but it's just so important. If something's free, I mean, the vaccine is free. We all know the vaccine is free, but anything else that's offered to you for free, it's probably too good to be true. And these people are smart. We're a captive audience. Everybody's home now. They're either working from home or they're home because they don't have their job right now. So we are like an open book for these people to call, to email, to text, to be on social media. So we just have to be so aware. Some of the emails that come across my email, I don't know about yours, they're very clever. And if you're not really looking at it, it's very tempting to click on it. But you have to make yourself stop and go, wait, I didn't ask for this. I didn't request this. So just the best thing is don't do it. If you didn't initiate it, just don't do it. Okay, next slide. Many people are vaccinated, but a lot of our younger folks now are having a lot targeted toward them, and pretty soon, hopefully it's going to open up to even the younger kids. And there you go, another area for more scamming. So our vaccine should always come from a trusted source, from our clinic where we go, our PCP who we see, from Department of Health, from the hospitals and other health organizations that are offering them in the community, not from anybody else, because it's just not true. And there's no cure right now. So don't be clicking on anything where they're talking about that there's a cure, and nobody should be calling you, asking you for your social security number, your Medicare number, or any financial information if you're just trying to get a vaccine. It's just not happening. It screams the word scam, right? Next slide, please. This one's interesting. These are some other cases of Medicare abuse and fraud that are out there. The first one on the list, genetic testing and clinical lab. Has anybody heard about the Becky from Medicare robocall? So first I heard of it. I was watching, what was I watching? CBS this morning, and boom, this thing from AARP pops up there. And it's this Becky from Becky from Medicare robocall. I have to find it because I have it here. You guys, it's amazing. I was amazed. I'm not going to read you the whole thing, but it starts out, "Hi, this is Becky, your patient advocate working closely with Medicare. Currently, Medicare is offering precautionary genetic cancer screening nationwide and has recommended that anyone over the age of 50 be tested. These tests help to detect signs of cancer, blah, 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 and they're covered by your insurance. And if you don't act soon, Medicare may label you as ineligible for coverage." Please press
Marianne,
1.
excuse me, you're on video stop.
Oh, I am.
Yeah,
Crap,
go
I'm
ahead.
sorry.
You can just repeat the last few sentences that you just said.
So
Great.
they pressured them to take advantage of the opportunity, because if they wait, they may not be eligible for it in the future. So please press 1 to talk to specialists. It's so clever, you know, but yeah, I guess this is pretty recent. So, and interestingly enough, on the AARP website, they refer people to SMP to help report if they come across, if they get phone calls like this. But it's all part of that DNA testing. And just know that DNA testing, it's not ordered freely. It has to be from a doctor, and it's only in limited situations. So if you or your family member or someone you're caring for is at a senior fair or any kind of activity, and sorry, I got my paper, and there's somebody's trying to sell this to them, just don't do it. Don't give them any information. It is not for real. And then unfortunately, there's physicians and other practitioners who are scammers. They commit fraud. They bill for stuff they didn't do, or they code a higher level code to get more money. You can see some of the other ones there that do it. Even ambulances. Ambulance service can be billed for somebody who doesn't meet the criteria. Their records are padded a little bit to make it look like they need an ambulance and to justify it, but they really don't. And then some other big ones that occur is called prescription shorting, where a pharmacy they fill a prescription, but they don't fill the whole prescription, yet they bill Medicare for the full amount. And there's actually been in the recent past some pharmacists in Detroit and Southern Ohio, they got charged in a $12.1 million fraud scheme involving prescriptions that either were not sent at all, and some of them were sent after people had passed away. So, and just another note too, in Florida, about a month, in April, actually, there was a man convicted to 10 years in prison doing a scheme similar to that robocall from Becky. He got convicted. You know, they're out there. Sad. Okay, that pretty much gets to the end of my presentation. I want to have you walk away. Just the main points is, which I'm going to give you the answer if I say this, so that's okay. That's okay. Hold on, Bill, which is okay. Mainly that abuse is services that maybe aren't medically necessary, or they don't meet the standards, or fraud where it involves an intent to defraud or to gather people's information and falsely bill for stuff that maybe didn't even occur. Those are the two main things that I'm hoping folks walk away with today. And on that note, the next slide is a quick check for understanding, just to kind of drive home that point. Give everybody a moment to take a look at those answers.
And I think Debbie, thank you so much, Marianne. I think Debbie has this launched very good.
Awesome. Good.
You want to go ahead and cover the material here?
So the first response is the definition of abuse. The second one is not really, well, it is apropos to what I was talking about, but it wasn't one of the main points. So the correct answer is the last one, where fraud is, again, is that intentionally billing Medicare for services that either never happened or billing at a higher rate than what's allowed.
And for these polls, Debbie, we'd like to get, we want to get 80% or better.
Right.
We've been doing these presentations virtually since August 11th last year. And so to get 100%, even though we only have 2 people, we'd like to get as many people as possible. So good for you. Good job, guys. So now you know what abuse is in the context of Medicare scams. Let's move on to the next one. Let's see here. Is that the last one? Okay, very good. All right, we're going to save that second poll for Bill's part. At this point, I'd like to just thank Mary Ann Kadick. And one of the things that I wanted to make sure all of you know is that Mary Ann Kadick and Bill Morrow are both trained counselors. The training never stops. They can self-train. We have training tools on our website, our internal or intranet system at S&P. So if you become a volunteer, you're always supported through these training modules, as well as group dynamics when we meet together, and then one-on-one. So I want to thank Mary Ann for the time and effort and preparation for her part. And this time now, we're going to segue over to Bill Morrow, who's going to talk a little bit more about the protection plan that we prescribe to, as well as volunteering. Bill?
Good morning, ladies and gentlemen. Thank you, Norma. Debbie, thank you. 3 steps to prevent healthcare fraud in Medicare, and that's prevent, detect, and report. Next slide. Again, well, do's and don'ts. Okay, you see, there's more do's and don'ts. The biggest thing is you want to treat your Medicare number like your Social Security number, your driver's license, credit card, whatever. You just don't want to give it out. Try never to give it out over the phone, even though you know it's your doctor's office calling. Try not to give it out over the phone. Tell them you bring it with you to the next office visit, whatever. The problem is phone lines are not secure. Hackers get stuff from telephones, computers, email, whatever. So unless you have a satellite secure phone from the government, don't do that. Don't ever give out your Medicare number. And don't accept money or gifts for free medical care. That's a big no-no for the government. If you get a free gift for medical care and you don't pay your co-payment, then that's wrong. Medicare will find out eventually. Next. Here's the new Medicare card. It came out in 2018. It changed, took your Social Security number off because the government passed an act or a bill removing Social Security number from everything but the Social Security Administration, and of course IRS, right? IRS gets everything. So there's some phone numbers for the Social Security Administration and the website. You should have an account at SSA. Okay, next. Detecting Medicare fraud abuse. You get a medical summary, Medicare summary notices or explanation of benefits. You either get it monthly or quarterly, depending on how you set up your program or how often you see the doctor. The government feels it's your responsibility to verify what's on the explanation of benefits, the date of the visit, what was done, etc. There's some numbers there you're not going to know about. There are procedure codes and stuff. You don't need to worry about it. The date, who did the service, and what service was provided is the important part. If none of it matches up with your knowledge or with your recollection, you need to contact the provider. Okay. If you see the same service down there twice on the same date with the same provider, you need to contact the provider. Okay. If you get nowhere after contacting the provider, contact Medicare, or you can contact S&P. We will help research and see what's going on and take it from there. Next. Here you see the personal healthcare journal. You can get a free copy today just by contacting S&P, and we'll send it to you. It's a small document, looks like this. Oh, there we go. Okay, it looks like this. You can open it up, you put your information, well, I guess not. You can put your information in there, the date of service, who did the service and stuff like that. That way you can keep track of your healthcare. If you're doing this for your mom, your dad, or your customer, your consumer patient, that's not bad. It helps them realize what's going on. Sometimes, you know, as we get older, we tend to forget things. And well, lucky for me, I have a spouse. She lets me know what I forgot. So it's okay. Next. There we go. Resources available. We have the 3rd edition of fraud prevention and resource guides. That is really good. I've got one here someplace, but you can take you can do contact the Attorney General. You work with the Attorney General, Commerce and Consumers Affairs, and we try to stay up to date on what fraud scams are going in the Medicare arena. Next. Oh, okay. Medicare, 1-800-Medicare or Medicare.gov. You should set up your own program, My Medicare, if you can. Some of us are not computer literate, but get somebody to help you set it up. You can be your son, your daughter, whatever, somebody, especially if you trust your son or daughter. We have this Hawaii SHIP, the state health insurance program, assistance program, free local one-on-one Medicare counseling, presentations and training. Now, this is important. I know you guys watch television just like I do. And there's commercials now because it's starting to get that time of year for Medicare change. So you can change your health insurance type of provider or whatever. And you see Joe Namath and some other sports athlete up there, JJ Walker, I think it is. And they're talking about, I didn't get all the services I'm available to. Well, that's not true. Medicare is limited. These companies that they're representing are authorized by Medicare to offer more services, but not charge you more money than what Medicare would normally cost. Okay. So if you pay $149 for Medicare a month, that's all they can charge you for. Okay. Some companies are better than others. Some have more co-pays than others. Okay. So you got to really look at it. You're not getting more. You're not getting Medicare stuff. It's just that Medicare says these companies can offer this, and they're monitored heavily by Medicare. They just can't come on TV and say, oh, I can get rides, this, that, everything. It has to be approved by Medicare. And then you have long-term care budgeting program, which helps identify, investigate results, complaints made by the residents concerning actions and inactions, as may be. Okay. To give you a case in point, my mother had terminal illness, and the doctors felt she was going to pass away, so they put her in hospice in Texas. So it's what you guys are working with. Unfortunately, after 3 weeks in hospice, she got better. So they had to take her out of hospice, and they had to send a letter to Medicare indicating what the changes were and why she came out of hospice. And then 2 months later, she went into hospice and subsequently passed on about 8 weeks later. But I mean, these things happen, okay? And it's just Mother Nature testing us. That's all. Next. Report suspected Medicare fraud. You have to report it. If you think you've been scammed or there's been fraud, contact SMP. We will research the area of what's going on, and we will provide detailed analysis back to you. And if necessary, we'll refer you to one of our partners that we mentioned earlier. And as you see, our phone number is up there. We have toll free, and we have email, and of course our website. So feel free to contact us. We will research whatever we can to help you and alleviate your worries. Okay, next. Testing your knowledge. 3 steps to prevent healthcare fraud, errors, and abuse. I like the first one: permit, conceal, or withhold, but that's not the answer. Okay.
So we'll get this launched. We'll do this poll launch. Thanks, Phil. Let's see how our audience does with what we just talked about. What are the 3 steps to protecting yourself from fraud, errors, and abuse? Is it permit, conceal, withhold, prevent, detect, report, or be polite, give them whatever they ask for? Hopefully we get about 80% or better.
Do another 5 seconds and I will end the poll.
Then we can launch the results. Perfect, thank you. All right, we had way more participants, 9 more. So 11 for 11, 100%. Good job, Debbie, getting all these people here. Bill, thank you so much. I think you'll continue on with this presentation. I just want to make sure that we all understand these two parts are really one whole presentation where we give you a foundation of fraud, abuse, and errors, and then we go into how to protect yourself. With this information, please remember, send this to everybody that you know and love, your trusted friends, your family, your calabash, your networks, and we'll now continue on with the presentation on Bill with volunteering. Thank you, Bill.
Oh, thank you. I'm still up. Okay. Volunteer. We all, volunteers are much aligned. Okay. Some people don't think a whole lot about us, but helping older adults fight back and championing a worthy cause is worthwhile to volunteer. If you have a particular knowledge level or a particular skill that can help our kapuna to progress through, then you should volunteer. Our kapuna, and it didn't really strike me until I became a kapuna, but our kapuna are not as literate as I am or as you are. I became computer literate back in the 80s, and I've worked with computers since the 80s and up until today. We can always use volunteers. Roles, as you can see, exhibitors, counselors, complex interactions specialists, administrative support, and information distributors. Volunteerism is a very important part, and it keeps your mind sharp. It really does. It'll help you stay sharp, and you can talk back to your spouse. Okay, next. Sorry. Making an interim lasting, immediate and lasting difference. It really does. There's not one person at least one person you will reach and touch. And if that's all you do is reach and touch one person, then you've done your mission. You've done your volunteerism. We're not asking you to go out and touch 10 lives or 12 lives or whatever, okay? You will eventually. But if you can touch one person and assist them and help them and turn it around to where they feel safe and comfortable in today's world's environment, then you've done your mission. Next. Why I volunteered? My wife was getting scammed. She was getting a phone call from Chicago. It said it was the CDC inoculation center, and they wanted to know, I don't know what they wanted to know. We never answered, because as soon as I saw CDC Chicago, I said it's a scam. CDC's in Atlanta. But the thing is, you have to be aware. If you answer the phone, they're going to ask you questions. They're going to try and get financial information from you. Don't give it to them. COVID-19 people, contact tracing. Contact tracing does not ask for medical information or financial information. All they ask is, do you know so-and-so? When was the last time you were in contact with them? Where were you in contact with them? That's all they want to know. They don't want to know how much money you spent on that encounter, what your social security number is, what's your Medicare. They don't need that for contact tracing. If the Board of Health needs it, they'll send somebody to your house with proper credentials, and then they'll be able to get the information they need. So, scamming is real simple. If we can help our elderly not to be scammed, or even our young people not to be scammed, then I feel I've completed my volunteerism, my mission, since I've retired. I want to stay sharp. I really do. So it's very important that the interesting people you meet may be as knowledgeable or more knowledgeable than you are, and it makes you take a back seat and listen sometimes. Even young people, can be smarter than I am. Not too much, but even young people can be smarter than I am.
Thanks, Bill. I wanted to make sure we have May Fuji. Yeah, we have May Fuji also on this call. I know she's not part of this Zoom panelist, but or team, but she's been with us for a long time, and she also volunteers on our Hawaii Ship sister side She does a lot of behind the scenes. She does presentations like this too. So I see she's on the call as well. I want to bring Marianne back and just share a little bit why you chose SMP. Thank you, Bill.
Thank you.
Go ahead, Marianne.
So I blame it on you, May. That's a good thing. No, I honestly, I think it's even more isolating being on the outer islands right now with COVID, and we just don't interface with people and we don't get a lot of information necessarily. So I saw the commercial on TV, the ad on TV with May, and she just, in my little blurb there talks about healthcare with compassion. And that's such a big thing with nurses, caring with compassion. And so there's May's face on this ad on TV saying, if you've been scammed, it's not your fault, with so much empathy and caring. And I just went, it's not, but people have to be able to get the information they need so that they feel like they have some kind of power and control here, and that we can make good decisions, and we're not victims. We don't have to be victims. So thank you, May.
Thanks, Bill, so much. You have so much information and knowledge, and the fact that you actually called in a scam and DOH, Department of Health, contacted me the next day, you already said, yeah, okay, I'll volunteer. That was pretty quick. I wish all of my onboarding experiences were that brief. And Marianne, we truly appreciate all that you do as well. You guys are ace volunteers. And like you said, Bill, no matter how small the task that you can offer up, it truly helps us. So at this time, we're going to wrap up, and we hope the last 40 some minutes were well spent with you. We see people from the Department of Health on this call. Thank you so much for joining us. We see people out there in the community. I see my math teacher from Wailua High School, Harvey Ouchi. I now can call him Harvey. So thank you so much for being here. It's interesting how you bump into people in Zoom calls you haven't seen for a while, but we'll catch up and you can critique me and how we did today, Mr. Ouchi. Harvey. All right, our last poll is really about how we delivered the message to you. So let's launch this. Your opinion really does matter. Tell us what SMP's mission is. Is it to empower and assist you, your family, your caregivers about healthcare fraud, errors, and abuse through all these types of education and outreach? Is it to optimize the health you have right now and the safety you feel and the independence of kupuna? Is it to advocate for residents in long-term care facilities? We think you'll score high.
Another 5 seconds and I will share the results.
Gosh, Debbie, you must be a business manager and marketer as well, because you work in seconds, which I love. Right on. Okay, so 9 out of 9 makes us for a perfect 100. Good job, Bill and Marianne. You see, it's all time worth spent. All right, we have come to the end of our journey with you. Please don't let it end. We want to make sure that you get a copy of the free fraud guide, as well as the personal healthcare journal. We call it the fraud guide in the house because the Attorney General's office, the Department of Commerce, Consumer Affairs, Narcotics, Public Safety, we all huddle around for about a year trying to put out the best work. So this is 3rd edition of our fraud guide. It was 5 years ago when we put out the 2nd edition. So 3's a charm because we think this is our best work. We also want you to visit SMP website, and that is www.smphawaii.org. You can get the electronic version if you want, and also get a copy of this actual presentation if you want. So we're pretty transparent when it comes to all these products. If you want it, just ask us and we'll send it to you. We would be remiss if we didn't find out how we actually did as engagers. So how would you rate the knowledge you've gained today? And how would you rate our delivery? Mainly Bill and Marianne. Did you learn all this already? Did you learn something new today? Or everything was practically new to you? And as far as our delivery, were we difficult to understand? Were we average, so-so, or were we pretty good? Did we meet your expectations? Maybe even hopefully exceed them a little bit? We want candid answers. So thank you so much.
I see people are still voting, so In a couple of seconds, I will end this. Okay.
Okay, so about 8% of you said you learned all of this. 8 is a good Chinese Pake number. I'm part Chinese, I can say that. So I'd like to know who you are. Something new, 85% of you. And again, 8. Okay, everything was new to me. So magical number 8. And the volunteers all know this. My magic numbers are 3 and 8. I can tell you offline what it's all about. So how would you rate our delivery? Wow, okay, that's very validating. Always room for improvement. Thank you so much. All right, moving on. At this time, we want to remind everybody that our numbers, our email, our SMP, everything, contact information is on this PDF, PowerPoint presentation as well. For those of you, we just want to utter the numbers 808-586-7281, 586-7281. Will take you to the main line, and our counselors like Marianne and Bill have designated numbers or days. So we have 6 trained counselors. They check the phones except for Sunday, and then Monday is actually Bill, so he carries the Sunday, Monday. Toll free, neighbor islands elsewhere, 1-800-296-9422, 1-800-296-9422, our smphawaii.org. Please visit our website. We are so proud of it as we continually update it. And then if you just want to email us, it's info@smphawaii.org. We are a grant-based program. You can check us out and visit all of the other SMPs throughout the nation. Just Google SMP California, SMP Puerto Rico, SMP Virgin Islands, you'll get their website. At this time, we'd like to really humbly and sincerely thank you for this